This is a 24-year-old man who presented with proteinuria, hematuria, and sensory neural deafness. Which of the following protein structures is likely to be abnormal? Choice 1, type 3 collagen, then laminin, type 1 collagen, fibrillin, and type 4 collagen. So what is the answer? The answer for this question is type 4 collagen, because a patient presenting with hematuria, proteinuria, and sensory neural hearing loss, that is characteristic of Alport syndrome. In Alport syndrome, the protein, the most abundant protein in our body is collagen. In Alport syndrome, type 4 collagen is abnormal. Let us see what is Alport syndrome. This Alport syndrome is also called Alport syndrome. It is also called hereditary nephritis. So it is an abnormality of the type 4 collagen. This type 4 collagen is present in the basement membrane of various organs like kidney, then eyes, and cochlea of the ear. So when the type 4 collagen is abnormal in this disorder, these patients will present with hematuria, that is renal, sensory neural hearing loss, proteinuria, and renal failure. Then eyes are involved and it will result in, classically it is anterior lenticonus and subluxation of lens also is seen in some patients. Cochlea, it will result in sensory neural hearing loss. So this is Alport syndrome. So this patient has come with the proteinuria, hematuria, and renal failure along with the sensory neural hearing loss. So it is a case of Alport syndrome. So how is it inherited? It is most common mode of inheritance is X-linked dominant. X-linked dominant mode of inheritance. That is the reason why the disease is more severe in males. In females, usually it will not cause much of a renal failure. It will cause hematuria and plus deafness or hearing abnormality. Whereas in males, it will cause very severe disease with renal failure, then plus sensory neural hearing loss. Why it is so? Since it is commonly transmitted as an X-linked dominant disorder, in females there are 2 X, whereas in males it is X plus Y. So if one X in this one is abnormal, it will cause Alport syndrome. But in female, even if one of the X chromosomes is abnormal, the other one is there. So one more is there, no? So that will compensate for that. So it will result in these things actually. That is, it will, to some extent, it will neutralize the effects of the other hormone, other X chromosome. Then what about the other? Then one more thing. So let us see what is anterior lenticonus. Anterior lenticonus means normally this is the appearance of the lens. So lenticonus means the lens is that structure. So this is called anterior lenticonus. So this is the lens. So when it is bulging forward, that is called anterior lenticonus. So then what are the other things? That are the other diseases which are related to this abnormalities of collagen. Type 1 collagen, that is associated with the type 1 collagen, it is associated with, is seen in bone and tendons. When it is abnormal, it will result in osteogenesis imperfecta. Type 2 collagen is mainly in cartilage. Type 3 collagen is commonly seen in the reticular fibers. And type 4 collagen, it is seen in, as I have seen, kidney, eyes and ears, and abnormality will cause Alport syndrome. Then laminin, that is the other choice. It is abnormal in congenital muscular dystrophy. And finally this fibrillin, that is abnormal in Marfan syndrome. Marfan syndrome is characterized by this Marfans, that is mitral valve prolapse, aortic aneurysm, retinal detachment, fibrillin defect, arachnodactyly, negative nitroprusside test. When it is positive, it indicates it is homocystinuria and subluxation of the lens.